Welcome to the Medical Office Assistant, Nursing Unit Assistant, and Dental Office Administrative Assistant virtual information session. I think that's the only time I'm going to say all of those out fully. That's a mouthful. We thank you so much for joining us on such a beautiful sunny Sunday. We appreciate you taking the time. My name is Cindy Meisner, and I'm the program coordinator for two of those programs. And Jill Headland is also joining me. She's also a program administrator for Okanagan College for one of those programs as well. And we're so happy to have you join us. I'll just go through the agenda. So we'll be talking about the rewards of an office assistant career in the health industry. We'll go over when the next intakes are for the program. And then we'll do a quick overview of the three different programs. We'll discuss what the admission requirements are, and then talk about what employment opportunities there are, and then what your next steps are. For questions, you're welcome to put questions in the chat at any point, and we'll get to those as quickly as we can. When one of us isn't talking, then the other one can man the chat bar in case there's questions that come up. Otherwise, we will have an opportunity for questions at the end. So rewards of a health admin assistant career. So normally we find people that take this type of program, you're definitely a giving individual. You want to be in that helping profession. So normally to this type of person, you want to build relationships, and definitely that is something you can do with patients and staff. Depending on the type of office that you're in, you definitely can have some longevity with patients, normally we find this is something that is important to you. So another reward of this career is providing compassionate care. You're usually a very empathetic person, and you really like helping people. Definitely all three of these careers offers a very interesting task-oriented type position, and that will vary from office to office depending on if you're in a specialty or just how big your office is, because that can vary quite a bit too. Normally for someone in this career, it's very rewarding to work in a team environment. So you like that atmosphere. Depending on the office, there is a lot of regular office hours that you would be working at. Unless you're in like a health industry where it's like a hospital, then you may not have as regular hours as some of the other offices. And within all these industries, there's different opportunities for advancement. So it sometimes can be a stepping stone to something a little bit bigger. So there always is opportunities that you can pursue. So next we'll talk about the different intakes for the different programs. So for medical office assistant, our next intake is January 12th, and it will run through to some part in July, depending on when your practicum placement is. And then the next intake after that will be September to April. Tuition for that program is just under $3,700, and then your texts and materials are approximately $100. The nursing unit assistant program is only offered once a year, and it's offered September to June, and it is offered through each of the three campuses, so Vernon, Penticton, and Kelowna. So when you're applying for that particular program, you'd want to pick the program that you're closest to, whether it be Vernon, Penticton, or Kelowna, because the practicums are designated with those accompanying hospitals. Tuition for the nursing unit assistant program is just over $5,500, and texts and materials are approximately $260. The dental office administrative assistant runs once a year, September to February, and it's just over $1,500, and your textbooks or materials are approximately $50. So I'll first review what the medical office assistant certificate is comprised of. So this program is comprised of 336 hours. And the first component is medical terminology. Now this is the same, a similar course that is involved with nursing unit assistant and with medical office assistant. Medical terminology is a very difficult course. You're learning anything and everything about the body, and there is a lot of memorization involved in that type of course. So that will definitely be the hardest out of all of them. And pharmacology, you're learning about all the different types of medications, which is really critical to working in any type of medical office. They also learn computers and transcriptions and medical office systems. So you're learning one of the more common office computer systems for that medical office use for patient tracking and all their record systems and for billing. You'll learn the basics of medical office procedures, and then what are some of the workplace skills. And then you'll finish off the program with a 90-hour practicum. So this program was recently revised and enhanced by an industry committee. And so it now offers a few other components like the pharmacology and the workplace skills and the practicum. It used to only have a observation. So that's definitely a huge improvement for this program. Next up, we have Nursing Unit Assistant Certificate, and I'm going to let Jill talk about this program. Jill, we need you to unmute.
I'm so sorry. I'm so sorry. Yes, thank you very much, Cindy. Welcome, everybody, as Cindy said.
Can you increase your volume a little bit?
I'm having difficulty with my volume today, Cindy. I'm not quite sure what's going on, so I'm just gonna,
okay. Just talk as loud as you can.
I'm just going to have to speak up. I seem to be having some technical difficulties today. Yes, so as Cindy said, medical terminology, slightly different curriculum to the medical office assistant program, but 72 hours in duration, and it is the foundation of the program. So it can feel like a little bit of a slog going through, but it's the foundation for everything else to come. And as students go through the program, they appreciate exactly why there was so much involved with that. That's followed by a fairly short module on communication skills. And then we start diving into all of the tasks that an NUA will do in the hospital. So patient chart records, putting those together, what do they look like? Admissions, transfers, and discharges obviously speak for themselves, what they are. Pharmacology again. And then there's a lot of time spent on processing medication orders, lab orders, diagnostic orders, interventional orders, and that's using Meditech. So the hospitals use a system called Meditech, and students will have, they have it's not the live Meditech, obviously, but a lot of hours are spent working with Meditech, really getting to know that inside and out, so that when you go into practicum, you are ready to be using the live system in the hospital under supervision from your preceptor, obviously. The practicum is 125 hours long, and sometimes the practicums are split. Quite often you can be, the students can be on 2 different units, or sometimes even 3 units. It really depends which hospital and what's going on in that hospital at that time. As Cindy said, whichever campus you apply to, you should expect that that is where your practicum will be, because practicum spots are limited. So the number of seats for this program is also more limited than some other programs, because we rely so heavily on the hospital for those positions. Once you have this certificate, you can go anywhere within BC, and I've heard of other people taking it elsewhere, but certainly there's a huge number of job opportunities with this certificate.
Excellent, thanks, Jill. So the admission requirements for the medical office assistant and the nursing unit assistant programs are the same. You either need to have been a recent grade 12 graduate or mature student, and you need to have English, completed English with 60% or an equivalency. You need to complete a negative tuberculin test, and once you're admitted into the program, we would give you instructions on how to get your criminal record check done. Then finally, to the dental office administrative assistant program. So this program is 120 hours, so it's a bit shorter than the other two. It only has 3 components to it. So it's communication skills and then introduction to dentistry. So that's where you're going to learn the language of the dental office. So all about the different teeth and the different parts to the mouth. And it's actually really, really interesting. And the final component is dental office procedures and computers. So that's where you'll be using some of the more popular office computer systems that dental office use for billing and what their specific procedures are for those offices. So admission requirements for this program are just either the grade 12 or being a mature student. So slightly less requirements for this program. So employment opportunities. First, we'll start with medical office assistant certificate. So basically, if you take the MOA program, you can be employed in a variety of different offices. So hospitals, medical offices, care facilities, different health authorities, health units, health service agencies. And then there's also complementary health offices, whether it's massage therapy, chiropractor, acupuncture. All of that medical terminology knowledge that you have is relevant to such a big area. And we're really proud to be working with the Central Okanagan Division of Family Practice. And they communicate with all the general practice doctors in the Valley. And they provide connections for us for practicums and then also for employment opportunities. So we're happy to have that partnership with them. Next up, I'll have Jill talk about nursing unit assistant.
Yes, and so again, many opportunities within hospitals, care facilities, across health authorities, health units, health service agencies. Within the hospital, NUAs are very often moving from role to role, from unit to unit, and also within, if you've got the NUA certificate, there's also possibilities to transfer into a medical office as well. There's some crossover there. The health right now, the hospitals are graduates seem to be quite in demand. Quite often, graduates may start off with part-time hours. They might start off with sort of filling in for people on vacations, but we've certainly had very high levels of employment for our graduates coming out of the program in recent years.
That's right, Jill. Definitely, there have been a lot of employment opportunities available throughout the Valley for nursing unit assistants. And from what we're hearing, that's just going to continue as there are a number of retirements coming through. So for dental office admin assistant certificate, employment opportunities would be any type of dentistry. So there's many different types of practices for the dentistry industry. So everything from a general dentist to a pediatric, orthodontist, a periodontist, an endodontist, oral surgeon. So the possibilities are quite large depending on what area you're from, and quite a rewarding career, just like the other two for sure. So for the health certificates, if you're looking at applying to either the MOA program in January or the other two programs in September, you are able to apply now. I posted the link there. You have to ensure that you choose the faculty continuing studies, because it can be quite confusing in there. If you don't have that faculty chosen, you won't be able to find them. And some of our programs sound similar depending on what department you're in. So just a little note on that. And as Jill mentioned, for nursing unit assistant, it's really important that you apply to the campus that you're closest to in location, because that's where the practicum placements would be held. And we do have a limited number of placements available at each of our hospitals. So it's really important to make that distinction when you apply. So the second step then is you would be communicated with and required to meet the admission requirements, and all our communication now is done via email. Then after you've met those requirements, you would be offered a seat in the program. You'd receive a letter offer of admission, and then at that point you would pay a non-refundable deposit, and then you would register into the program. And of note, none of these programs are actually student loan eligible, unfortunately. So that is a downside to these certificates. And so just a quick note about that. If you're looking for a student loan, that isn't something that would be available through Student Aid BC. So if you want further information on these programs for medical office assistant or nursing unit assistant, please contact Leslie Stevenson, and I have her email posted there. For dental office administrative assistant, please contact Chrissy Roms, and I have her email listed there on the slide. And then next up, we have time for questions. We wanted to make sure that everybody had ample time to ask any burning questions that maybe we weren't able to provide information on previous, or maybe we just didn't think of. So just put your question in the chat box and we'd be happy to do that for you. I believe you may be able to unmute yourself and then ask the question verbally if you'd like. I might be able to do that for you. I'm not sure with the settings, but I'm happy to try. And then I wanted to remind everybody, so anybody that registered for the open house today, you are eligible to win up to a $5,000 tuition credit, which would solve all your student loan problems. So remember to go here, okanagan.bc.ca/tuition giveaway. So make sure you enter that draw, that you're eligible to do that for attending this information session. So let's see, Jill, are there any questions here? Doesn't look like any questions.
I don't see anything yet.
I'll put this back to the information page. So again, if you have any questions or want more detailed information, definitely connect with Leslie or Chrissy. Their email addresses are listed there on the page. And I don't know, any final thoughts? Oh, we have a question here from Joanne. Regarding the computer component of the dental program, I'm wondering if the software used can be practiced at home. Yes, actually, Joanne, definitely. So that is something that happened to all our programs in March when COVID-19 lockdown happened. All our programs went from being in class to online. We were able to very quickly and successfully make software available to our students via different sharing that we had set up through our IT department. We have that set up and in place for the coming year. And so it actually works really, really well. Our students from this past year were able to, no problem. Any other questions? Actually, maybe, Jill, that's something that we could talk about. So at this point, all of our programs are online. For some of our programs that have more hands-on components, and I'm speaking generally, we have brought students back onto campus following very strict health and safety guidelines and following a plan. But those are more like the health, nursing, aesthetics type programs. And any program that needs that hands-on component, like with nursing unit assistant with Meditech, we may be able to do that. And so it just depends on the program and what the needs are of that.
Yeah, so currently the NUA and the MOA and DAA are all online, but that situation is ever evolving. So who knows what next fall will look like? It may be that that there is more possibility of coming on campus for some elements, but that will be something that students will be updated as the situation changes. It's all a very, very big unknown out there for everybody.
And it is for everybody with no matter what you're doing. So back to Joanne's question, she's how many pieces of software? I believe for the dental office, what we did last spring is we actually provided software on laptops and had students pick up laptops at the office. I'm not too sure what they're doing this year. I think the software will just be available to students through a shared network file. But that's something that you can email Chrissy about if you want to get more information on that. Myrna, you're asking about software use for medical office assistant compatible for out of province. So we are using a program called Med Access through TELUS. What we find with any of the computer software, whether it's dental or medical, all the softwares are very similar. So it'll be similar. Will it be compatible? I don't know if it would ever be compatible, but definitely it would be relevant for sure. And you'll find, well, at least I find in BC, so many offices use so many different computer software systems. So it just depends where you're going to end up and where you're going to be working. So now Carissa is asking about, can I start medical terminology before the program so I can get a refresher for it? So our distance education program department does offer medical terminology. You are welcome to take that program. It is definitely offered in a different format than what we want to offer through the actual MOA or NUA program, where it's more like distance, you do your work, do your quizzes and tests on your own, and you complete the program, where we're trying to get more interaction with an instructor and with the class. So it is possible, Carissa, but I don't really recommend it. I really recommend that you do the actual medical terminology within the program.
You could for sure get the book ahead of time and sort of work through the book. It's called The Language of Medicine. And if you contact the contact we've got up here for MOA and NUA's Leslie, she would be able to let you know which exact version of that book is required, and you can buy it through the Okanagan College bookstore, or you could go to Amazon and purchase a copy. It's just important to get the right version, because otherwise the page numbers change and it can be a little bit difficult to keep your place with everybody else. But that would be a great idea to get the book ahead of time.
Great questions, everyone. That's fantastic. Any other questions at this point? I'll just give it a couple minutes here because we're still on time. We still have about 5 minutes left for the information session. So if you're trying to get your question down, we'll wait for you here. I'll also mention for nursing unit assistant, our program at the Vernon campus. We take placements and do practicums with the Vernon Jubilee Hospital here in Vernon. And then we also usually place 1 or 2 students at the Shuswap Lake General Hospital in Salmon Arm. So it is a great opportunity for anybody coming from that area that is hoping to get a chance to work in that industry. I know a lot of younger students that take the nursing unit assistant program use that program as a stepping stone into further training in the health. So whether it's LPN or it's nursing or who knows, it definitely has been used as a stepping stone by some of our students in the past, which is fantastic. I see we got a couple other questions. So Joanne, for the dental program, how many hours of homework per week? Oh, that's a really good question, Joanne. I don't really have a good answer for that, but that would probably be a better question to send to Chrissy. Generally, all our programs, you are expected to do some homework per week. You would have a class 2 to 3 times a week. And when they're online classes, they're not a full 3 hours, because what we found from experience, nobody can be on a computer for 3 hours without having their brain shut off. So it's not an effective way for learning. So you definitely can count on a variety of different hours per week, but it also depends on yourself and what type of study habits that you have. Myrna, you're asking, I believe you indicated that the program is delivered via online. So this would consist of daily Zoom meetings. Yeah, so the program typically runs 3 nights. Which one are you referring to first off, Myrna? Medical office assistant. Okay, so typically the medical office assistant runs Tuesday, Thursday evenings, and Saturday mornings. And so you would have classes either 2 or 3 times a week, and they would be either an hour to 2 hours at a time. We use a platform similar to Zoom. It's called Collaborate. We use an educational platform called Moodle, and that's where all of your computer coursework is kept. So all of your course packs, your information, your handouts, your quizzes, your exams, everything is done in Moodle. And there's a link in that to go to Collaborate. And it's very similar to Zoom. So it's not daily. You would be doing that 2 to 3 times a week. And then you would have your own time after online class time to work on your actual program. Chris is wondering if you wear scrubs for the NUA program. And if so, do I buy them from the college? Typically, you do wear scrubs for the NUA program. When you're on campus, I know for the Vernon program, we required it 1 day a week. We picked Wednesdays, and every Wednesday you had to wear your scrubs. Now that we're online, I'm not entirely sure that the instructors are going to make that a rule. So you'll have to wait till class to see if that happens. But definitely, if your program is on campus, then you would have to wear them to at least one class. And no, you don't have to buy them through the college. Health for the hospitals, you can wear any type of scrub. There's all sorts of colorful scrubs available at a lot of different stores now, like Marks, and different medical supply places carry them. A lot of thrift stores carry them because people come and go or change sizes. So it's not something you have to buy through us for sure. Yeah, those are fantastic questions. Jill, did you have anything else to add?
I was just going to say the thrift stores for sure, and I'm always tempted to buy some of them because some of them are so colorful.
I know, I love some of the prints nowadays. It's great.
Yeah, Value Village always has a ton as well.
So we got a couple minutes left, so we'll just wait to see if anybody else has any questions before we end our session. And I'll just put up the reminder slide about applying for the tuition credit, because that would pay for either of any of these programs if you're looking at that. So that would be a fantastic way to end your 2020. So we hope that you go to the tuition giveaway link and enter that contest. So we're at a 1:30 and I don't see any further questions. So Jill and I would like to thank each and every one of you for participating with us today. We've had a lot of fun and we love the variety of questions. We hope that if you have any other questions about any of our training programs at Okanagan College, that you'll reach out to us. We're here to help, and we hope you enjoy the rest of this glorious afternoon.
Absolutely.
Take care. You're most welcome, everyone.